Good day, I'm Jessica Pomales. My capstone is what do social work and nurses students know about sexuality among older adults? And we're going to explore the knowledge and attitudes towards the older adult sexuality. Let's start with a definition of the World Health Organization. Sexual health definition is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely in the absence of disease, dysfunction, or infirmity. For older adults, sexuality is an integral part of their lives, and they see this as a way to connect with someone else. Also, being sexually active for older adults represent good health and well-being. Older adults are 65 years and older. Since older people have sex, the elderly population need to be educated about sexually transmitted diseases, including protecting themselves and what products they may use to enhance pleasure or minimize pain during sex. The older adults population is diverse and growing, and they want to hold on their sense of independence and keep thriving in their sexual and intimate relationship while they can. Haisler also indicated in Europe that nurses, providers, and caretakers do not anticipate older adult sexual needs, and the older adult sexuality puts them out of their comfort zone. Therefore, they feel less confident talking about sexuality with their clients. A quantitative study made in New Zealand University studied knowledge and attitudes towards sexuality through a different lens. The population their target was medical and nursing students. And here they found that religion and political, especially the one that turns to the right wing, were directly related to negative attitudes toward this sexuality. This study was 288 medicals and 288 nurses. In addition, the study found that the lower your knowledge of sexuality, more inclination to the negative attitudes towards sex. And they suggested that to modify these attitudes of the students, they should add in the curriculum some type of role play so they can enhance the education of the student, and this may improve their attitudes and knowledge towards sexuality. It's like to desensitize, like make it normal. Why social work and nursing student knowledge and attitudes toward aging sexuality? Well, first of all, sexual health is a human right. There is a literature review that demonstrated that the elderly with chronic illness have been assumed that they are asexual by the society we live in. A comparison between social work and nursing student in the United States is important because other studies were around other countries, and also the students that we study from HBU will be assisting the geriatric population in the future. The study was intended to reshape the HBU nursing and social work curriculum in regards to aging sexuality. We did three hypotheses. One, if there is a difference between undergraduate social work students and nursing student attitudes towards older people's sexuality, if there is a difference between undergrad social work students and nursing students' knowledge toward older people's sexuality, or there will be a negative correlation between religiosity scores and the aging sexual knowledge and attitude score from all students. The method that we use, we recruit through a convenience sample. It was students from social work and nursing from the undergrad from Pacific University. The data collection was quadric. We got from their gender, religion, age, student years, and student year of undergraduate and the marital status. We choose two measure scale. One measure scale is composed of two subscales, the ASCAS. One is the attitude, 26 questions, Likert scales, 1 to 7. Greater the number, better the attitudes, or more positive, or more permissive. For knowledge was 35 questions, was true, false, or I don't know. And in here, lower the numbers, greater the knowledge. For the center of religiosity scale was 5 questions, a Likert scale 1 to 5, greater the numbers, and more religious. The data analysis system that we used was SPSS to do the independent sample test and the Pearson correlation. The results, we only have a small sample of 11 people. 6 were social workers and 5 were nursing students. And there is the percentage. Here are the hypotheses and the results. If you can see, P, all of them were greater than 0.05, meaning that there is no significance in anything of what we did. So we accept the null hypothesis. So there's no differences between undergraduate social and nursing students' knowledge or attitudes toward sexuality, and there's no correlation between religiosity and knowledge and attitudes. Here is an example of the graph. If you can see the religiosity and the dots in the top, it doesn't matter how religious you are. It doesn't matter your knowledge. If you can see, you can have a little cluster there, but it's like no significance. And in here, the same with the attitudes. You see, oh, doesn't matter how religious you are, attitudes is the same. You know, you have a little bit more permissive, but the sample was so small that we cannot say. Limitations, small sample. 2, the scale was supposed to be 5 questions and only 4 were provided. So it was an incomplete scale. Conclusion, there are no differences in knowledge and attitudes between nurses and social work students. 2, religiosity does not have a relationship with knowledge or attitudes toward older sexuality in the HPU. For future study, the recruitment of participants needs to have a better outlet, such as flyers and emails directly to the students. Also, due to lack of participants for future studies, the graduate program should be included. No significant difference between groups of knowledge and attitudes were found, so there is no need to revise the curriculum of HPU. This is my reference. Any questions? And thank you for listening.